Welcome to another edition of Tuesdays with Dr. Tew, Summer Fitness Series. Today we're going to be talking about muscle strains, and we're here with Sherry. She's a very active mother of three who likes to play softball in the summer times and doesn't know when to slow down sometimes. So we're going to be working on a quad strain that she's developed. Most people know that the immediate treatment of a strain usually consists of the RICE protocol: rest, ice, compression, and elevation. Today what I'm going to do is run you through what I do in office to help speed up the healing process and get you back to your sport or activity a lot faster. In the acute phase of an injury, we use electrical muscle stim and ice to help decrease inflammation and pain and speed up the healing process. One of the things I like to do in the subacute phase is use instrument-assisted soft tissue mobilization. This helps decrease muscle tone and helps align the forming scar tissue fibers with the muscles. Another type of treatment I do during the subacute phase is kinesiology tape. This helps to lift the skin and reduce swelling, and it's a way to have a passive form of treatment going on while the patient's out of office. They can take anywhere between 2 weeks and 3 months to heal, depending on the severity. This is why you want to get started on treatment as soon as you can after the injury occurs. Obviously, not all muscle strains can be prevented. You're going to have accidents, but a good way to help avoid them or prevent them is to make sure you warm up properly before your sport or activity. Also have a good stretching or flexibility routine that you go through. Thank you for watching this episode of Tuesdays with Dr. Tew, and we'll see you next week.